Welcome to the Ultimate Guide Module 2, Registration Competencies. Learning Objectives. After completion of this module, participants will demonstrate an understanding of the following registration competencies. Challenges of registering patients of specific age groups, small children, older children, adolescent, elderly patients. Registration's role in infection control. Avoidance of clinical hazardous materials. Module 2 Self-Assessment. Question 1. Which age group is it most important to keep waiting time to a minimum because of a decreased attention span? School children, option A. Late childhood and adolescent, option B. Adults, option C. Seniors, option D. Question number 2. Since it is often difficult to immediately determine if a patient has an infectious disease, the Centers for Disease Control (CDC) recommends the following to be used on all patients. Blood and wound precautions, option A. Isolation procedures, option B. Sterile gloves and respirator mask, option C. Standard precautions, option D. Question number 3. If a patient presents to a registration desk stating that he thinks he may have been exposed to a toxic substance, the first thing that the registrar should do is put on gloves and a mask before gathering information from the patient, option A. Immediately notify clinical staff of the patient with a possible hazardous material contamination, option B. Notify hospital security to lock down the hospital so no others will be exposed, option C. Have the patient wait in the far end of the waiting room, far away from others, option D. Question number 4. If a part of the patient medical record is contaminated with blood, the employee should make a clean copy and destroy the contaminated paper, option A. Set it aside until it dries, then incorporate it into the rest of the record, option B. Place it in a plastic sheet protector for handling and storage, option C. Have the person who originally completed the form redo it, option D. Question number 5. Under OSHA regulations, an OSHA safety program must have all of the following core elements. Cause no harm, option A. Prevent injuries and illnesses, option B. Determining which companies are required to follow OSHA regulations, option C. Management, leadership, work, participation, hazard identification and assessment, hazard prevention and control, education and training, program evaluation and improvement, and communication and coordination, option D. Question number 6. Blank are designed to reduce the risk of transmission of microorganisms to staff and other patients from both recognized and unrecognized sources of infection, practiced on all patients. Gown and gloves, option A. Standard precautions, option B. Question number 7. Blank questions why, knows address and phone number, short attention span, keep waiting times to a minimum, increasing independence, learns appropriate social manners, fears loss of control, the unknown, bodily injury involved in conversation, allow child to have some control, keep explanations simple. Adolescent, option A. Small children, option B. Adults, option C. Seniors, option D. Question number 8. Blank enjoys learning, able to discuss problems, conceptual as well as concrete thinking, provides clear explanations, peers are important, fears loss of control and bodily injury. Observe body language as clues for feelings. Allow and respect normal expressions of emotions such as crying and anger. Adolescent, option A. Small children, option B. Adults, option C. Seniors, option D. Question number 9. Blank is at the peak of their mental abilities, verbal skills, information recall, reasoning. Consider role or culture and lifestyle, health concerns, has many responsibilities including children and aging parents. Keep calm, pleasant approach, maintain eye contact, and provide privacy. Adolescent, option A. Small children, option B. Adults, option C. Seniors, option D. Question number 10. Blank has decreased memory, slowed down in the ability to process information, increased concern for health, retirement, death of a spouse or friends. Identify self, repeatedly having to hear information if necessary. Address title by title or last name, not first name. Speak distinctly, provide privacy, and reduce distractions. Adolescent, option A. Small children, option B. Adults, option C. Seniors, option D. Age-specific criteria. Special care is taken to address the specific needs of all patients. Registration and scheduling personnel, as well as other access staff, are required to be competent on age-specific considerations, including the knowledge of growth and development and the ability to obtain and interpret information on patients' needs. Listed on the following pages are examples of cognitive and psychosocial characteristics and tips for registering patients in some age groups. School children. Cognitive description. Questions why, knows home address and home telephone number, and has a short attention span. Psychosocial description. Acquiring an increased independence, is learning appropriate social manners, and fears loss of control, fears the unknown, and bodily injury. Tips to communicate with school children. Become involved in conversation with children. Allow the child to have some control. Keep explanations simple and keep waiting times to a very minimum. Late childhood and adolescence. Cognitive description. Patients who enjoy learning, who are able to discuss problems and have conceptual as well as concrete thinking. Psychosocial description. Their peer groups are very important to them, and they fear loss of control and bodily injury. Tips for communicating with childhood or adolescents. Observe their body language as a cue for their feelings. Allow them to express themselves and their emotions. Respect them and their normal expressions such as anger and crying. Adults. Cognitive description. Patients who are at the peak of their mental abilities with verbal skills and can recall information and use reasoning. Psychosocial description. Has health concerns with many other responsibilities, possibly including children and aging parents. Tips to communicate with adult patients. Remain calm. Use pleasant approach. Maintain eye contact. Provide privacy and consider the role and their culture or lifestyle of the patient. Seniors. Cognitive description. Patients who may have an increased memory loss and slow down in the ability to process information. Psychosocial description. The patient has increased concern for their health, and they may be retired and or have had a death of a spouse or a close friend. Tips to communicate with seniors. Identify yourself repeatedly if necessary. Address the patient with respect by their title and their last name. Speak distinctly and provide privacy and reduce distractions. Infection control. Standard precautions are practiced on all patients. Transmission-based precautions are designed for patients known or suspected to be infected or colonized with highly transmissible pathogens, for which additional precautions beyond standard precautions are needed to interrupt transmission in hospitals. Since medical history and examination cannot be reliable to identify all patients with infectious microorganisms, Precautions should be consistently used for all patients. This approach, recommended by the CDC, is referred to as standard precautions, and it should be used in the care of all patients. Bodily fluids, to which standard precautions apply to blood, all body fluids, secretions, and excretions. Intact skin and mucous membranes for any patient that is anticipated. Gloves will be worn for touching all bodily fluids. Mucous membranes or non-intact skin of all patients and for the handling of items or surface soiled with body fluids. Gloves will be worn when performing puncture and vascular access procedures. Gloves will be changed after contact with each patient. Masks and protective eyewear and face shields will be worn during procedures that are likely to generate droplets of body fluids to prevent exposure of mucous membranes of the mouth, nose, and eyes. Gowns and aprons will be worn during procedures that are likely to generate splashes of body fluids. Hands and skin surfaces should be washed immediately and thoroughly if contaminated with body fluids. Hands should be washed immediately after gloves are removed. Proper hand hygiene prevents 90% of infections. All healthcare workers should take precautions to prevent injuries caused by needles, scalpels, and other sharp instruments or devices during procedures. To prevent needle stick injuries, needles will not be recapped, purposely bent or broken by hand, removed from disposable syringes, or otherwise manipulated by hand or by registration staff. Healthcare workers who have oxidative lesions or weeping dermatitis will refrain from all direct patient care, from handling patient care equipment until the condition resolves. If an essential piece of paper, part of the medical record, is contaminated with blood or bodily fluids, it is to be placed in a plastic sheet protector for handling and storage. Implementation of standard precautions does not eliminate the need for other transmission-based isolation precautions, airborne, droplet, contact, and/or special. Tuberculosis, TB, a potentially severe contagious disease, has been on the rise for the past 10 to 15 years. Since droplets in the air spread the disease, a patient with active disease can transmit the tuberculosis bacteria whenever they cough, sneeze, or speak. If you inhale the bacteria, you may become infected, but not show any symptoms. The infection may remain dormant for many years. Symptoms of the active disease include cough, fever, chills, and weight loss. This disease can be detected through skin tests for tuberculosis. It is essential that healthcare workers be screened per hospital policy for this disease. When a healthcare worker must be in direct contact with a patient that has TB or is highly suspected to have TB, a respirator, the mask, should be worn. The type of respirator and on the occasions under which the respirator is to be worn should be a part of the healthcare organization's infection control practices. Protecting healthcare workers who respond to emergencies involving hazardous substances is critical. Healthcare workers dealing with emergencies may be exposed to chemical, biological, physical, or radioactive hazards. Hospitals providing emergency response services must be prepared to carry out their missions without jeopardizing the safety and health of their own workers. Of special concern are the situations where contaminated patients arrive at a hospital for triage or definitive treatment following a major incident. Healthcare workers in an occupational setting such as hospitals, clinics, and medical laboratories may be exposed to a variety of agents and as a result of contact with patients whose skin, clothing, or personal effects have been contaminated with a dangerous substance or through contact with contaminated equipment. Most such substances do not lead to a contagious disease. Ideally, local fire and rescue first responders within the community will have coordinated emergency response planning with the hospital before an emergency event. National Incident Management Systems, NIMS. However, the hospital may need to treat contaminated victims of an emergency incident without the benefit of the pre-emergency planning. Both scenarios need to be addressed in the hospital's emergency response plan, along with the plans for responding to a hazardous substance incident that occurs in the hospital itself. The hospital's emergency response plan must be prepared in writing and established before an actual emergency. All employees and affiliated personnel are expected to be involved in the emergency response, including physicians, nurses, maintenance workers, and support staff should be familiar with the details of the plan. Employees with the potential for initial contact with hazmat victims should immediately notify clinical staff if a patient indicates that some type of hazardous contamination may have occurred. Clinical staff should immediately place the patient in a private room and close the door to limit off further contamination of the area. Clinical staff should wear appropriate personnel protection equipment, PPE, and ensure that non-clinical personnel are protected. Employees with the potential for an initial contact with a hazmat victim should not handle any items, telephone, pen, paper, etc., that the patient may have touched before identifying a possible contamination. Place possible contaminated items in a Ziploc plastic bag, protecting hands and avoiding direct exposure. Notify the appropriate emergency staff per hospital policy to secure the area of possible contamination, investigate the site, and determine the need for decontamination procedures. Remove any personal items that may have been exposed to contaminants. Place them in a plastic bag and secure. Thoroughly wash hands and other potentially exposed areas. Report any symptoms that may be associated with the suspected contamination to the clinical staff. Module 2, Post-Module Assessment. The answers will be revealed for each question.